think that, you know, meeting the patient where they are in terms of recommending dietary therapies is really important. I use diet a lot in my treatment for irritable bowel syndrome of all subtypes. So in the last 15 years or so, dietary strategy like the low FODMAP diet, like a gluten-free diet, for example, have have kind of like gotten to like the forefront, both in terms of patients' mind, but also in a lot of, gastroenterologists and even primary care's practices. But I really think that, if we're talking about like which patients benefit from dietary treatment for the irritable bowel syndrome, it's really ideally prescribed to patients with IBS who have insight into their symptoms and they
Yep.
believe that what they're eating, either the particular foods they're eating or just the meal itself, will kind of like generate or worsen IBS symptoms. And so those who are motivated to make the necessary changes are those that are going to be do the best with that strategy. So kind of to that, in that vein, a patient who has that insight to their symptoms, I think is really key when you're trying to figure out which treatment to offer a patient. It's also important to know who's not a good patient for this strategy. So for example, those who are at risk for malnutrition, those who are have a history of an eating disorder, for example, or disordered eating, not even necessarily something that's been diagnosed, but a history of disordered eating, those with multiple comorbidities, and also those who have food insecurity. So people who don't have a lot of say over like their food options on a day-to-day basis.